Okay, yeah, so these are the questions that I wanted to ask you, if that's all right. And then, you know, if I ask you questions first, and then you can ask me questions. I don't know. Let's see how it works here. Well, my first question is, are there any, if you were suffering with kind of really low mood, or you're really worried, would you want to go to a doctor or a nurse? Or what would stop you from going to a doctor or a nurse? Yeah.
No, because the number of time it takes to be referred on services.
Okay, right. So I don't know if people heard that, but that was the amount of time. So if you go to see a doctor or a nurse, then they'll see you, and then your worry is that they might not do enough for you, and so if you need to be referred to services, that can take, depending on what the problem is, it can take months. And that's true. I'm not going to say that's not true. That's absolutely true. You know, the waiting lists for mental health services in Greater Manchester and around the country, I suppose, can be really long. I wouldn't want to. There's two things, I suppose. One thing is that is a national problem. That I'm talking about what we can do as a community. One of the things we can do is come together to make political change, I suppose. That's not necessarily, that's a big ask, you know, to find the time to sort of engage in political activism. So in terms of addressing your concern, GPs can do quite a lot themselves. They can't do everything, so there are, and that's the reason that sort of mental health services, psychiatry services exist. But yeah, I take your point. Any other? Yeah, go for it.
There's a taboo or a lack of awareness of what mental health is and mental well-being. And I think, especially our community, they don't know what the different mental health illnesses are, and they're too afraid to speak up about it. To think, if you have a mental health condition, you're automatically labelled in our community as crazy, or something like that, or there's something spiritually wrong with you. So I think there needs to be a lot of education around that as well, but also education that's culturally and religiously appropriate for the South Asian community.
Yeah. Okay, thank you. If people didn't hear that, you're talking about the sort of stigma around mental illness, around mental health problems, and around a sense that if I'm someone who goes and speaks to a doctor about my problems with my emotions, maybe there's something wrong with me, or people will think there's something wrong with me. I don't know if you would you like to say anything about that? About
I also want to ask that question as well. I mean, I've also mentioned that as well.
Okay.
I do find, because I've been in the service for quite a few years now, but in the beginning, what I found was there wasn't a lot of South Asians referrals into the service, because we've been doing quite a few of these seminars as well, and making awareness in the community as well about mental health. So slowly, but surely, kind of like breaking that barrier as well, and we are seeing a slight increase in the South Asian community into our service as well.
yeah.
But this, I mean, I do take the point about making this awareness, because I think a lot more needs to be done as well.
Yeah.
About creating that awareness. Plus, it's also about educating. It's also about educating them as well about what mental health actually is. It's not about, this is also an illness as well that can be dealt with. The other problem we're having in our service is when people get referred, it's like explain what family service is, family care is, and what secondary care is as well. So they're not only, like you mentioned before, like it's only 6 to 12 sessions as well. But what happens after that? So it's like explaining to them that after we don't shut the doors on you, after this consolidation, we can't help you for back again as well. So yeah.
Great, thank you. Should have given you the mic, really.
I can also say, I've got a few, I mean, if you do, I mean, if there is time, I think,
that would be great.
डॉक्टर पुष्कर ने आपसे 4 सवाल पूछे वो कह रहे हैं कि आप क्या समझते हैं कि आप ऐसी वजह हो सकती है कि डॉक्टर आपको डिप्रेशन और एंजाइटी की कोई दवाई देगा आप लेंगे उसको और क्या आप ऐसा समझते हैं कि आप डिप्रेशन और एंजाइटी के बारे में अपने डॉक्टर से बात कर सकते हैं और क्या अगर आप किसी रिश्तेदार को किसी अजीज को बच्चों को अगर आपके डॉक्टर प्रिस्क्राइब करते हैं मेडिसिन एंजाइटी की डिप्रेशन की उसके बारे में आप क्या फील करते हैं और अगर आपका मूड बहुत लो है और आप अपने बेड से अपने घर से निकलना अपनी मुश्किल है तो आप क्या करेंगे ये 4 सवाल हैं डॉक्टर साहब ने पूछे डॉक्टर पुष्कर ने 4 सवाल आपसे पूछे हैं कि क्या कौन सी ऐसी वजूहत हैं जिनके आप डॉक्टर से बात करेंगे या नहीं करेंगे अगर आप उर्दू में बता दें मैं आपको ट्रांसलेट कर दूंगा अगर आप इंग्लिश आती तो आप डॉक्टर पुष्कर को ये 4 सवालों का जवाब बताएं उसी को आता है Thank you, Dr. Just translated your questions.
Yeah, thank you. While you're thinking about that, perhaps I'll just say as well, that I think you're about to talk about your big life service. The service, all mental health services are confidential, so if you were to present either to, if you were to go to your GP and talk about, or any doctor or nurse, they wouldn't then, publicise that to everyone. So it would be private between you and your doctor or your nurse. So that worry around feeling ashamed, perhaps that might help to reduce that sense of shame. But it's easy for me to say, please don't feel ashamed, because these are problems that everyone experiences. But also, it will be private. Did anyone have any responses to the questions?
अगर हमें फिजिकल प्रॉब्लम होता है ना हमें अगर फिजिकल कोई प्रॉब्लम होगा जैसे हम करें किसी को हार्ट अटैक हो गया तो वो हार्ट अटैक के बारे में सबको बताएंगे लोग इकट्ठा होकर बड़ा बिगेस्ट गोस हैप्पी भी हो गए कि चलो लेकिन जो मेंटली जो बीमारी है वो भी उनका भी इलाज है तो कहने का मतलब मेंटली बीमारी को कुछ पाते हैं फिजिकल का तो फॉर्म बता देते हैं तो मेंटली भी उसी तरह से है कि ये भी इतनी वर्स नहीं होनी चाहिए कि आप लोग अगली उस पर कंट्रोल करते हैं
Okay. I call someone.
If there's a
Should I translate? She's like, if someone gets like heart they don't mind telling other people that, oh, I was suffering from this, but if they have mental illness, they don't like sharing that.
Yeah.
And also, they need to know that there are treatments for this, and it's just like any other like physical illness, it can be treated, and there's no problem sharing that. But people don't do this. That is what she said.
Thank you.
One thing I like to point out is a person who's suffering with depression, and it's hard for that person to recognize himself that there's something wrong, first of all. So how can he go to doctor and explain what's going on when it's very difficult to get to the doctor these days. Plus 10 minutes visit is not going to recognize his condition. So it's very, very hard for the person who's suffering and the rest of the people who's suffering with it, Plus, no person can say, they're suffering with the mental health, depression, anxiety, everything all together. They're not going to say, oh, there's all this happening to me, straight away to the doctor. And the doctor only going to give 10 minutes of his work, and that's it. It's very, very hard to get through if there's very hard to recognize there's something wrong with the person. And people with the professional health and hard to recognize. They need to give a proper assessment for that kind of situation to recognize more easily then making it difficult for the rest of the member of the family as well.
Yeah.
It's very hard.
Thank you.
Not easy.
There are like three points there, I think. Of one, the person who is suffering with like really extreme emotions, they might not kind of really see it as depression or anxiety themselves. They might not realise that that's what it is.
That's right.
Also, if we go back to the slide actually that kind of described what depression and anxiety were, as well as that, if you are depressed or anxious, you might not be able to get out of bed, you might not be able to get out of the house, so how are you going to go to the GP? So yeah, if you're suffering with low motivation, struggling to even make yourself breakfast, how are you going to make an appointment to, I don't know how difficult it is to get a GP appointment here, but sometimes it's quite an effort, isn't it? So that's one of the points, I suppose, where it helps for us to support each other and to recognise, I've hopefully given you some things to look out for here, that perhaps you can notice in your friends and your family, and perhaps you can notice these things and say, look, ask people, how are you doing? Notice that you haven't seen you as much. So maybe help to support if you notice your friends or your family struggling with things, and maybe you can offer to make an appointment with the GP or suggest that they ring Big Life, which I know you're going to talk about it, but I think you can ring as well, yeah. So easier than necessarily going to a place physically. Yeah. Thanks.
I have one thing, not the last thing to say. It's
Yeah.
just that sometimes people don't even friends and family can go to them and you're like, oh, I can't even get out of bed and stuff like that. They don't take it seriously. They're like, oh, you're being too sensitive, you're being lazy, just get over it. They don't even consider it an illness. They're like, just get over it. So that's why I think people need to know that it can be a problem.
Yeah.
That is what it is.
And most of the time, I imagine, when friends and family are saying things like that, they're trying to be helpful in some way, I imagine. They think, just put your ideas up, look, and I suppose maybe I can help, hopefully this presentation will help people to see that there are different ways of being supportive. Sometimes that can be helpful, can't it, of someone just telling you to get out of bed, but not always. And sometimes if you realise that actually that hasn't worked, maybe you can find another way to explore why it is that someone isn't getting out of bed or isn't getting on the bus or isn't getting on the tram or whatever it is. Because there might be something troubling them that might need addressing. Yeah.
In my clinical practice, the issue is antidepressants. They take time to work. If I'm giving antibiotics to any patient, after 2 to 3 days, they will start feeling better. But I think the issue with antidepressants is that first is compliance, and they need to be made aware that it will take time. It won't be after a few days you'll be absolutely fine.
Yeah.
So I think from medicine point of view, that's what I've come across.
Yeah.
And from the talking therapy, I think there's a huge language barrier, and perhaps counseling services they may not be culturally appropriate as well. So.
So I imagine you're going to talk about some of those cultural appropriate and language issues, which are real concerns. And for people to want to go and talk about the problems, they have to know that it's a service that they should trust, and that where they'll be not just listened to but actually heard. So that's a really good point. I think you're going to talk about. Antidepressants, antidepressants take weeks to really have any noticeable effect, and during the first couple of weeks, you have to continue to take them every single day. And if you miss a couple of days, then it's not going to work as well. So I think that's something that perhaps if you know people who are antidepressants or on antidepressants, or if you are yourself taking antidepressants, it's worth just kind of knowing that and spreading that knowledge that antidepressants take weeks to work, and during that period you have to take them every single day. If after 4, 6 weeks, 8 weeks, you find that they're still not working, it's possible that maybe that antidepressant isn't the right one for you, or you need a higher dose. So please speak to your GP or whoever has prescribed it, and make a decision with your GP about what you're going to do. Are you going to increase the dose? Are you going to change to a different medication? There's always another medication that could work for you. If you are going to stop the medication, then do that with the doctor, because stopping these medications suddenly can cause problems as well. That can be quite difficult to manage, so you have to stop them very slowly. Yeah?
If you are on the medication for quite a long time, antidepressant or something like that, and if you will come out of it, could you kindly shed some light on the withdrawal symptoms of the medication? Because sometimes you get addicted to it in the longer run. You have to keep using it, you might be, your medication will be increased from 50 to 100 mg or whatever. Then if you come out, what are the side effects or withdrawal symptoms or something like that, please?
Yeah, really good question, thank you. If you're taking these medications for a long time, addiction is not really the word I would use to, it's not that you've become addicted to it in the sense that you've become sort of dependent on it. But you're absolutely right that if you stop, say if you're on a high dose or any dose really of an antidepressant, and you stop it suddenly, it can cause problems, including like physical side effects that can include things like electric shock kind of feelings, headaches, nausea. So it does need to be done really slowly. And so that's what I meant when I said if you're considering stopping your medication or changing your medication, do it with your doctor, with their advice, and they'll be able to look at what you're on, what the dose is, and say, okay, this week take this amount, next week take this amount, week after that, and give you that sort of structure so that you don't experience the withdrawal effects. So it can be done.
For the example, a person taking the antidepressant tablets, been on it for like 6 months. How does the doctor and how that person can explain or feel better on this diet, that person suffering with the anxiety and depression already? So do the doctor or the nurse, they do any kind of assessment on that person, or they let them carry on taking the medicine the rest of the life?
Right, yeah. Good question. So I think the question is, if you've been on medication for say 6 months or a year or whatever, how will the doctor know or the nurse know? Is that right? Yeah. I guess it's like just in the same way.
How can they say, well, better now, stop it, or take a lower dose, or carry on, and how will that work?
So they'll speak to you and they'll assess you in the same way that they did when you first came in, when they made that decision to start the medication. They'll ask a lot of the same questions around how your mood is. Are you suffering with all of these kind of problems? Are you having sort of physical problems as well?
Mm-hmm.
What kind of things is your low mood or your anxiety leading you to do? What's it stopping you from doing, etc., etc. Now, if your mood hasn't improved yet, then the doctor or the nurse might say, okay, what about different medication, or what about an increase in dose? If your mood has improved and has then been kind of relatively stable for a period, then we have kind of evidence-based guidelines for how long you should be on each medication. So, for example, if you've been on an antidepressant for a year and you've been stable for that amount of time, and it's the first time you've been depressed, then your GP might talk to you about maybe coming off, as long as you are your mood is stable at that moment. And it's different, say, if you've had 2 previous episodes of depression or 3 previous episodes. And then you might, and also it's a decision that the GP will give you advice, but you might say, actually, this is only my first depressive episode, but it was so bad that I just want to stay on the medication forever now. Or you might not, you might be very keen to come off like very quickly after 3 months. So it's a decision that you make with the advice of your doctor, but ultimately you will still be the person in control. There was a question up back here.
any member हेल्प करना चाहता है लेकिन वो रेडी नहीं होता है कि उसकी हेल्प की जाए तो उसको कैसे एग्री किया जाए he needs help.
Issues like if a person needs help and he's not ready to be helped, how to make him ready?
He's not accepting the situation. He's not
okay. He's like in denial that I'm fine. Then he's not fine. So what do you do?
It's a really good question. I'm not sure that I have a great answer for that really. I suppose, part of the answer is around kind of offering whatever support that they will accept. Because, going to a doctor or a nurse is one thing, but all the other kind of support that I mentioned, perhaps that they might be ready to accept that. That's the main advice I would say. But obviously you can discuss it with a doctor yourself and see kind of, maybe they'd accept a home visit or something. That's not always possible, but, I don't know if is there anything else, perhaps Assel or John?
I think first of all, every member, they have to convince the person through the talking, show them as examples, and tell them what you get the benefit if you go to the doctor, and they tell you write the discipline and medication. So through the talking, like the therapy.
So offering them support and exploring why it is that they don't want to go to the doctor or the nurse, because they might have quite real fears. They might be worried that they're going to get sectioned or something. And there might be sort of concerns that you might be able to allay.
This is something we're facing as well, because sometimes when we get online referral, the family member will refer them to our service, or when we ring them, they're not willing to accept. So we need that contact from them, so they have to do this, and then we're stuck as well. We can't kind of like if they refuse therapy, then we
So the person, ultimately, the person who requires help is the person in control. So I suppose it's finding other ways to support them until they're ready. And
it's very difficult.
It's difficult,
So nobody like to say to themselves they got a mental health issue and another, especially in men's.
Another question. The possible medication के अलावा depression का इलाज
Is it possible to deal with the situation without medication?
Yes, I mean that's absolutely. So it's possible to deal with mental health problems without medication or talking therapy with kind of these support mechanisms that I mentioned. But when it gets to a certain point where something is so overwhelming, they might benefit from some sort of intervention, so whether that's talking therapy or medication. But people mental health problems won't necessarily last forever, even without medication. So things, if you deal with all of the things that are causing someone to feel depressed in the first place, then you might be able to address it that way.
Is there not any other way where they can talk and bring them out of that kind of situation, except medicine?
Yeah, I think that's exactly what we're going to hear about next, is talking therapies.
Yeah,
So
maybe they set a small group where people can feel comfortable about talking about themselves and
there are talking therapies that are in groups as well. I don't know if that's part of what Big Life offer, but yeah, that is something that is offered generally.
because maybe that can work, so it's better than taking medication and all that.
Yeah,
If that can bring them out of that condition.
yeah, absolutely. Great. Are there any more? Yeah.
I just want to add that in a lot of surgeries, there are social prescribers there, so they help patients with housing, benefits, and other things. So it would be worth asking your GP surgeon if there are any social prescribers there, and they can even help you with support.
Yeah, so that was about, if you go to your doctor and you're talking about sort of problems that you're having with your emotions, and your doctor realises that actually some of the problems you're having with your emotions are around not having access to work or housing or exercise, then the GP can refer you to what's called a social prescriber, who might be able to direct you in the right way to other services that, so not a medication, not a talking therapy, just another service that might be able to help you to solve problems in your life. So yeah, I think that's what you're talking about. So yeah, it's a really, really good point. Thank you. I've spoken for quite a long time. I think, was it right for hand over to you? Yeah, unless there's any other questions for me. I think this is going to be really helpful actually to hear from.
All right, thank you.
From the